Well, hello, future dental assistant. Are you ready to level up your skills and confidence? And you have come to the right place, baby, because I am about to give you 20 DANB questions pulled straight from the topics they actually test. No fluff, no tricks, just real questions that'll show you exactly what you need to work on. So go ahead and grab you something to write with or keep track of your score so we can see where you stand. But before we get started, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Let's get started. Question 1. What is the normal resting heart rate for adults? A. 40 to 60 BPM, B. 60 to 100 BPM, C. 100 to 120 BPM, D. 120 to 140 BPM. The answer is B. 60 to 100 BPM. Normal adult resting heart rate is 60 to 100 beats per minute. Below 60 is bradycardia, above 100 is tachycardia. Question 2. Which tooth surface is closest to the tongue? A. Buccal, B. Labial, C. Lingual, D. Mesial. The answer is C. Lingual. Lingual means tongue side, buccal is cheek side, labial is lip side, mesial is toward the midline. Question 3. What is the primary purpose of a dental dam? A. Patient comfort, B. Isolation and moisture control, C. Retraction, D. Impression taking. The answer is B. Isolation and moisture control. Dental dams isolate the working area and keep it dry during procedures, especially important for restorations and endodontics. Question 4. How long should you scrub hands before gloving for a surgical procedure? A. 15 seconds, B. 30 seconds, C. 1 to 2 minutes, D. 3 to 5 minutes. The answer is D. 3 to 5 minutes. Surgical hand scrub requires 3 to 5 minutes of thorough scrubbing to achieve proper asepsis. Question 5. Which instrument is used to remove excess cement? A. Scaler, B. Evacuator, C. Condenser, D. Burnisher. The answer is A. Scaler. A scaler removes calculus and excess materials like cement. Evacuators remove decay, burnishers smooth margins, and condensers pack material. Question 6. What does the term edentulous mean? A. Missing one tooth, B. Having extra teeth, C. Without teeth, D. Misaligned teeth. The answer is C. Without teeth. Edentulous means completely without teeth. Partially edentulous means missing some teeth. Question 7. At what angle should the PID be positioned for a maxillary occlusal radiograph? A. Negative 10 degrees, B. 0 degrees, C. Plus 45 degrees, D. Plus 65 degrees. The answer is D. Plus 65 degrees. Maxillary occlusal radiographs require a plus 65-degree vertical angulation with the PID pointing down at the patient. Question 8. Which type of PPE should be removed first? A. Mask. B. Gloves. C. Eyewear. D. Gown. The answer is B. Gloves. Gloves are the most contaminated and should be removed first, followed by goggles, gown, then mask. Question 9. What is the universal number for the maxillary right central incisor? A. Number 7. B. Number 8. C. Number 9. D. Number 10. The answer is B. Number 8. In the universal numbering system, number 8 is the maxillary right central incisor. Number 9 is the maxillary left central. Question 10. Which vital sign measures the force of blood against arterial walls? A. Pulse. B. Respiration. C. Blood pressure. D. Temperature. The answer is C. Blood pressure. Blood pressure measures the force of blood pushing against artery walls, recorded as systolic over diastolic. All right, y'all, score check time. Count your correct answers and drop them in the comments. You need at least 7 correct to be on track right now. Question 11. What does OSHA stand for? A. Office Safety and Health Administration. B. Occupational Safety and Health Administration. C. Oral Safety and Hygiene Association. D. Office Standard Hygiene Act. The answer is B. Occupational Safety and Health Administration. OSHA is the Occupational Safety and Health Administration, which sets and enforces workplace safety standards. Question 12. Which ingredient in alginate impression material controls setting time? A. Potassium sulfate. B. Sodium phosphate. C. Calcium sulfate. D. Potassium alginate. The answer is B. Sodium phosphate. Sodium phosphate is the retarder that controls setting time. More retarder equals slower set. Question 13. What is the term of the chewing surface of posterior teeth? A. Incisal. B. Occlusal. C. Lingual. D. Buccal. The answer is B. Occlusal. Occlusal refers to the chewing surface. Incisal is the biting edge of anterior teeth. Question 14. Which classification of motion should the dental assistant minimize? A. Class 1. B. Class 2. C. Class 3. D. Class 4 and 5. The answer is D. Class 4 and 5. Class 4, shoulder torso movement, and Class 5, full body movement, are least efficient and should be minimized to reduce fatigue. Question 15. What is the ideal position for the operator's stool height? A. Feet flat on floor, thighs parallel to floor. B. Feet dangling, thighs angled down. C. Feet on footrest, thighs angled up. D. Standing position preferred. The answer is A. Feet flat on floor, thighs parallel to floor. Proper ergonomics require feet flat on floor with thighs parallel to the floor to prevent back strain. Question 16. What is the primary advantage of composite resin over amalgam? A. Stronger material. B. Cheaper cost. C. Aesthetics. D. Easier to place. The answer is C. Aesthetics. Composite is tooth colored and bonds to the tooth structure, making it the aesthetic choice. Amalgam is actually stronger and easier to place. Question 17. How often must biologic indicators be used to test the sterilizer? A. Daily. B. Weekly. C. Monthly. D. As needed. The answer is B. Weekly. CDC and OSAP guidelines require weekly spore testing or biologic indicators for all sterilizers to ensure proper function. Question 18. Which radiograph shows the entire tooth and surrounding bone? A. Bite wing. B. Periapical. C. Occlusal. D. Panoramic. The answer is B. Periapical. Periapical radiographs capture the entire tooth from crown to apex plus surrounding bone. Bite wings only show crowns. Question 19. What is the most common site for oral cancer? A. Hard palate. B. Gingiva. C. Lateral border of tongue. D. Buccal mucosa. The answer is C. Lateral border of tongue. The lateral borders and ventral surface of the tongue are the most common site for oral squamous cell carcinoma. Question 20. Which matrix system is used for Class 2 restorations? A. Celluloid strip. B. Toffelmeyer. C. Mylar strip. D. Sectional matrix. The answer is B. Toffelmeyer. Toffelmeyer Universal Matrix System is traditionally used for Class 2 posterior restorations. Sectional matrices are also correct, but Toffelmeyer is the classic answer. All right, y'all, and that is the end of this round of questions. Count up your correct answers out of 20 and drop them in the comment section. 18 to 20 correct, you are crushing it. Keep that momentum going for round 2. 15 to 17 correct, you're on the right track. 12 to 14 correct is a decent start, but you do need to tighten up. If you have below 12 and you need more prep, do not worry. Go check out some of my full breakdown videos and come back and try again. And if you need more help, check out my comprehensive DANB study guide that's linked in the description box. Not only do you get all key topics so so you know exactly what to study for the test, but you'll get more sample questions and answers, an exam day checklist, a 6-week study planner, a cheat sheet, and so much more. Go ahead and click that link in the description box. And if you find this video helpful, smash that like button and share with a friend, and I will see you both on the next round. Bye.